am joined in the studio today by Cheryl Combs-Walker from Big Sandy Healthcare. You are a therapist at the Shelby Valley Clinic. Welcome,
Yes.
Cheryl.
Thank you for having me.
So you're here to talk a little bit about the importance of mental health care. Tell me a little bit about that.
Mental health care is something that often is seen as separate from our physical health. I think as a society we're really good at taking care of our physical health needs, but we neglect those mental health needs. It's important that we take care, in order to live our life to the fullest, it's important that we take care of ourselves as a whole, which includes our physical health, our mental health, and our spiritual health. Often when people complain that their life feels off balance or that they aren't happy, it's because they've neglected one of the three areas. And when we have a severe deficit in one of those areas, it often leads to difficulty in some of the other areas, such as a patient who's been diagnosed with diabetes. Often with diabetes treatment, it's also suggested that they modify their diet. And in modifying the diet, we have to have certain skills that are associated with good mental health care, such as adaptability, impulse control, the ability to delay gratification. So for the patient who does start to modify their diet and change their eating habits, they have to be able to learn skills to be able to cope with their emotional health on an internal basis instead of an external basis by using the food to kind of soothe themselves.
So often when people have mental health problems, they think medication is a solution, and it can be a great help. But it's also important to have therapy and to actually talk to someone.
Absolutely. While medication is a very important component for most mental health care, and it can absolutely improve most any mental health condition, there's also the need for the added component of therapy. And that's because most mental illness, such as depression, anxiety, trauma, have underlying issues such as faulty belief systems. We have lots of thinking errors. Sometimes there are undealt with emotions or things that are tied to events from the past. And it's important to have a combination of the medication treatment as well as the therapeutic intervention, such as cognitive behavioral therapy or EMDR, which is eye movement desensitization and reprocessing, to be able to help remove some of those underlying issues and learn new healthy ways of thinking and dealing with emotions.
And Shelby Valley Clinic, you offer mental health care services, but there are 3 other clinics with Big Sandy Healthcare that offer this. Tell us where those are.
Okay, so we have the Shelby Valley Clinic, of course, and then we also have Eula Hall, which is in Mud Creek in Floyd County, and we also have the Martin County Clinic, which has therapists housed there, and we also have a therapist in the school system in Martin County.
Great, okay. And so there's never an age that someone should be discouraged from going to a therapist if they need to. It's for anyone, really.
Absolutely, and we see a wide range of ages. Collectively, I think we have a experiential group that has seen couples, families, individuals, of adult and child. Of course, you do want to seek, if they're very young, you do want to seek someone specialized in play therapy, I think, for very young children.
In addition to therapy services and mental health care, Big Sandy Healthcare offers a wide variety of services. They have physicians, they have nurses, and they have a lot of clinic locations. Tell us about some of those.
Absolutely. I think that's one of the blessings of Big Sandy, is that they've been able to populate a lot of areas that didn't at one time have a lot of medical,
that are underserved.
Absolutely, underserved populations. Absolutely, that's the word I'm looking for. But so we have the Hope Clinic, which is in Montgomery County. We have the Martin County Clinic, of course. We have Eula Hall, which is in Mud Creek, which is the people who live in that area of Harold, I think, don't have a lot of access to it. It's quite a drive to get to any other clinics in that area. Then we also have the Shelby Valley Clinic, and which is here in Pike County, and we also have in Oxshire, which is also in Floyd County, the Physicians for Women, which has gynecology and also just regular family practice.
Great. All right. Well, thank you so much, Cheryl, for coming. And you'll have to come back and talk more about other mental health issues.
Okay. Well, thank you.